Huge demand, a stretched workforce and aggressive patients are just some of the issues facing many GPs, with some saying they now feel completely overwhelmed by the role.
Now, this comes as the most recent British social attitude survey found that patient satisfaction with the NHS is currently at a record low. Here's more from our health correspondent, Jen Smith.
Almost 18,000 patients are registered at this GP practice in East Devon. It has more than 20 GPs and far more support staff. And the problems it faces are typical of many practices like it in the southwest.
The telephone calls drive me mad because you're on the phone for ages, waiting and waiting and waiting. And yeah, it's not easy to get appointments, but I've got so used to it now.
Getting an appointment's a pain, and it's actually easier to come to the surgery and talk to the receptionist than being on the phone. I found that, but when you get the appointments, excellent. No complaints whatever. They're very good.
The latest British social attitude survey found record low levels of satisfaction with the NHS, with respondents citing dissatisfaction with GP services as one of the main reasons for this. But what's it like for the staff in general practice, who are constantly dealing with demand and pressure?
It is completely overwhelming, if I'm honest. And also there's, as a professional with professional standards, it's very hard to be a good GP when you are faced with that volume of work.
GPs come into general practice because they want to provide holistic care for patients and really good continuity. And I think we're as frustrated as patients at the moment that we're not able to do that. There is massive pressure on appointments.
I would say one of the biggest pressures for myself and my team are aggressive patients. We get a lot of patients that are fed up with waiting, and so working on the front line, the team get the brunt of that, and then the GPs have to pick that up as well.
We've been invited into Honiton surgery to understand some of the pressures general practice is under. During the election campaign, Labour promised to improve general practice, including bringing back the family doctor and ending the 8 a.m. scramble for GP appointments. So, now they're in power, what would clinicians and support staff like to see change?
I think the expectations of the public in general as to what they can have access to through their GP is far more limited than they realise, because the resources aren't there for all the services you assume are available.
General practice sees 95% of all NHS contacts and only receives 8% of the funding in the NHS, which I think most people would think, well, that's really strange.
We've really lost some of the key public health messaging, how to keep yourself healthy, how to prevent getting frail, how to really sort of look after yourself.
I think it takes a certain type of person to work in healthcare, because we know going in that it is quite restrictive on how much you're going to earn for the job that you're going to do.
The pressures that come with the role of the PSA receptionist are huge, and the pay doesn't maybe reflect how pressurised the job can be.
The government says it's determined to fix the problems in general practice, which is critical to making the NHS fit for the future. It added it will increase the proportion of resources going in primary care and help address the issues GPs face.
I'm very optimistic about the NHS. It certainly has challenges, but I think we have a lot of people who are working every day to overcome those challenges. Some things are within our grasp and we can do things to make them better now, and we should tackle those things straight away. Some of those things will take a little bit more organisation, and those are some of those national conversations that I'm sure are happening even as we speak.
Patient Pip isn't feeling quite so positive.
I don't see how they can make a change, to be honest. I really don't. They're up to their eyes. The NHS is now crippled, basically. So I just can't see how they can help. I'd love to see it improved. Gosh, wouldn't it be wonderful?
The British Medical Association says GP practices across the country are experiencing significant and growing strain. The new government has 5 years to improve services for patients and staff here in Honiton and across the southwest. Jen Smith, BBC News.
Insight there into the experiences of a number of GPs and their patients. The issue of general practice high on the list of priorities for the new Health Secretary, Wes Streeting. Wes Streeting does join us now. Wes Streeting, I will talk to you about this CQC assessment, the NHS watchdog, in just a moment. But I just wonder if you could give us a thought on how you think GP surgeries are able to cope at the moment, and whether or not there will be, whether it's a concern of yours, and what you are doing about it in terms of funding, for example, as one GP mentioned in that report.
Well, good morning. Firstly, GPs are really struggling. They are struggling, and patients are struggling to find and access GPs as a result. In fact, things are so bad and things have deteriorated so badly between the previous government and the profession that GPs are due to start collective action next week. And that's why in my first 3 weeks as Health and Social Care Secretary, I've had the GP representatives in every week pretty much. And we are working actively with officials to make next week's action unnecessary and to deal with the practical concerns that GPs have, funding being one of them, and also legitimate concerns that they have about the way in which general practice has been mismanaged. For example, we've got unemployed GPs in our country at the moment, at the same time as people are struggling to access a GP. I mean, that is how badly mismanaged the system's been. I think there are some solutions we can come up with fairly quickly, and I'm working actively with GP representatives to do that now. We'll have more to say on that shortly. We do also need to see that longer term reform, that shift in both, yes, the proportion of NHS spending that goes into general practice. I want to see that grow. But also the wider reform that means that we will do far more in the community, whether that's diagnostic testing, but also a wider range of clinics that we can actually have closer to where people live. So people think of the NHS as much as a neighbourhood health service as a national health service, because it's, as much as we love them, it's not all about hospitals. It's about making sure we fix the front door to the NHS so that people can see a GP when they need one, and they get the right care in the right place at the right time, and we're a long way from that situation today.
You've pledged to end this 888 scramble for GP appointments, for example. You've spoken about unemployed GPs. As I said, there's an issue of funding. Is an increase in funding to GP practices one of the things you're looking at?
Yeah, there are tough decisions to be made, and without preempting the Chancellor's statement on Monday, people have seen some of the newspaper headlines today. There are really tough choices to be made in terms of the public finances. I'm working really closely with the Chancellor and actually colleagues right across the Cabinet to help her make those tough choices. And obviously within NHS budgets as well, we've got to make sure we put the right resources in the right place. I think there are some things we can do quickly actually with GPs that will give them the confidence that this government is going to both move in the right direction, but also to work with them as we do so. I mean, one of the common things, you know, between what we've just heard from GPs, the junior doctors' strikes, where we've got negotiations now well underway to end those, but also more broadly across both the NHS and social care, has been a complete breakdown in the trust and the relationship that NHS staff and care providers have had with their government. And one of the things I've sought to do in my first 3 weeks is to hit the reset button and to start that process of rebuilding trust and a sense of professional partnership, because I can't turn the NHS around on my own. I need to mobilise that team of 1.5 million people who work in the NHS, well over 2 million who work across health and social care, to be part of that team effort needed to get our health system back on its feet and to make sure it's fit for the future there for us when we need it. So
no commitment to increasing budgets, but you are talking to the Chancellor in terms of difficult decisions, as you've said. I want to talk about
GP shortly. There is some light at the end of the tunnel, and I think we can move quite quickly on that, but I have more to say on that in the not too distant future.
And is there any point in me asking you if light at the end of the tunnel means more money?
Look, the whole argument we've made about economic growth is to make sure that we can invest in our public services and put more money back in people's pockets without having to hike up taxes in the way the last Conservative government did.
Let me move on. As you're well aware, time's always limited with us in the morning round. The Care Quality Commission, now this is responsible for regulating all hospitals, GPs, care homes in England. You have said you are stunned and it is unfit for purpose. What are you going to do about it?
A number of things. Firstly, honesty is the best policy. That's why I've moved quickly to publish the interim findings, because there are ratings that people will be looking at today which I can't have confidence in. I don't think the public can have confidence in, and I've asked the CQC urgently to put in place transparency around those ratings so that people can see how those ratings were put together and then make a judgment about whether it's a true and fair and accurate reflection of the quality of care. Leadership is vital. We need a new permanent chief executive at the Care Quality Commission and a new chief inspector of hospitals that we can work with to turn the regulator around, and we're going to get the best person for the job if we are honest about the challenge and also reassuring them that whether it's the board or indeed the government, we will give them every bit of support they need to deliver the radical reform that that organisation requires. And we've already got some work underway too. Professor Sir Mike Richards, hugely respected in this area, is already doing a rapid review of the assessment framework that's used to judge hospitals and care providers. But when I said the other week, in my first week as the Health and Social Care Secretary, that there were things that had genuinely shocked me that I had not been aware of when I walked into the Department of Health and Social Care, this was what I had in mind. I never expected to be told that 1 in 5 health and care providers had not received a rating, that some hospitals hadn't been inspected for a decade, that some of those ratings are effectively effectively kind of manufactured and invented using partial views and inspections combined with historic ratings and judgments. I'm absolutely appalled, and I hope people take confidence from the fact that this new government will never duck the difficult decisions, not sweep them under the carpet, not engage in a conspiracy of silence, because if we're honest about the scale of the challenge, we've got a much better chance of coming up with the right solutions. And I have hope that the NHS is broken, but it's not beaten, and we can and we will turn this around. And
this consultation, this review, was commissioned by the previous government, and of course you're picking it up now and seeing the results. Can you guarantee, I mean, some other things that are shocking to people, can you guarantee that an inspector who's going to visit a hospital would have had experience of visiting a hospital before? Because that was one of the things that was thrown up. Another was an inspector of a care home had never met a person with dementia. Can you guarantee that experienced people will be making these important assessments?
I can't make that guarantee today, but I can guarantee that's exactly the approach that we're going to be taking into the future as we reform the organisation. I do want to acknowledge one thing, and that is, for all of the damning indictment we've had from this review today, one of the things that Penny Dash, who's conducted the review, has told me is that within the Care Quality Commission are some brilliant people, hugely experienced, expert people who have been instrumental actually in sounding the alarm and providing the accurate diagnosis that Dr. Penny Dash has provided with her interim report. I want those people to stay. We need those people, and I want other brilliant people working throughout health and social care to step forward and come and join us at the CQC to make sure that this is a regulator that we can have confidence in to safeguard patient safety and to ensure high standards across health and social care. There are brilliant people working throughout the NHS and social care, but what we can't do is pretend that there are also not enormous amounts of failure to be seen. And for that failure to be rotting at the heart of the CQC is intolerable. We will not tolerate it. We will take the action needed to deliver the radical reform that organisation needs.
Now, when it comes to the junior doctors, you've had a meeting with the BMA earlier this week. You have already hinted that there are you've said it out loud, there are difficult decisions to be made, and yes, we have all seen the headlines about the deficit that the Chancellor is dealing with, the funding deficit the Chancellor is dealing with. In terms of what the junior doctors have asked for in terms of compensation and pay to cover the last few years, what are you willing to offer, or have you around the table said that there is an offer that meets them at least halfway?
So I'm really glad actually that junior doctors have been willing to come in and negotiate in good faith. One of the promises that I made to them was that I wouldn't provide a running commentary on those negotiations, and that's a promise I intend to keep. Negotiations are now well underway. People can see the bleak backdrop that we are working against, but I I remain as
when will a
optimistic
deal?
now.
When can we expect a deal to be announced then? Except you won't tell us what's being spoken about, but when can we expect a deal to be announced?
As soon as we have something to report, I will be back to talk to your viewers.
Timescale.
I promised junior doctors I wouldn't provide a running commentary, and I'm keeping my promise.
Wes Streeting, Health Secretary, thank you for your time with us on Breakfast.
Thank you for having me.